Hello, I'm Dr. Chase. It says here that your hand has been bleeding for 9 hours now.
Yeah, I cut myself cooking. It won't stop. I swear it's not even a big cut.
Oh, that's not normal. Has this happened before? Do you have a history of this?
Well, sometimes, like, I've cut myself in the kitchen before, like, shaving and stuff like that, and
Okay.
it just bleeds, like, forever. Even if it's, like, a really small cut, like a paper cut, it'll just bleed and bleed and bleed.
I think we could be possibly dealing with like a bleeding disorder of some sort here.
Oh.
I think we're gonna run some platelet function and prothrombin tests to see if that's the issue. Okay.
Sounds good.
All right, perfect. Results came back in. Normal platelet count, prothrombin time, and activated partial thromboplastin time are also within normal ranges.
Oh, so maybe hemophilia A or B, or a vitamin K deficiency?
Yeah, let's just test for everything except the most obvious choice. You ran platelet function and factor V3 tests, but didn't check for von Willebrand factor. Fantastic. It's like solving a murder scene and not looking for fingerprints. Test for von Willebrand factor antigen,
Factor 8.
ribosenin factor activity, and run these. Then maybe, just maybe, we can stop playing Guess the Blood Disorder.
Alright, factor 8 levels are slightly low, but the real issue, the von Willebrand factor antigen is at 25% of what it normally should be.
That confirms type 1 von Willebrand disease.
Yep.
Hate to say it, House was right.
Finally coming to your senses, I see.
So,
A genetic disorder where the von Willebrand factor is deficient. This means that platelets, they can't properly adhere to blood vessel injuries.
Wow, you figured that all out on your own? Finally doing some thinking.
Alright, well let's talk about the von Willebrand disease. It's the most common inherited bleeding disorder. It happens when the body either doesn't produce enough von Willebrand factor or it makes a defective version of it. Right?
yeah, and since von Willebrand factor is essential for platelet adhesion, without it, blood doesn't clot properly. That's why the patient has excessive bleeding from small injuries, nosebleeds, and prolonged bleeding after dental work.
Yep, von Willebrand factor has two key roles. It helps platelets stick to damaged blood vessels and stabilize the factor 8, which is necessary for the coagulation cascade. If the von Willebrand factor is missing or defective, factor 8 degrades quickly, making the bleeding even worse.
Von Willebrand factor is a large multimeric glycoprotein, and it is made in endothelial cells and megakaryocytes. It's also stored in legal bodies. Now, the main points of von Willebrand factor, its main goals are platelet adhesion and factor 8 stabilization. Now, there are three types. We've got type 1 and 3, which are quantitative. Type 3 is the most severe, and type 2, which is qualitative.
That explains why the patient is still bleeding.
But how do we treat it?
We could try factor 8 infusions.
Antifibrolytics?
We give them Desmopressin. Desmopressin is a synthetic analog of vasopressin, and like natural vasopressin, desmopressin binds to V2 receptors on endothelial cells, leading to von Willebrand factor release. There you go.
Interesting.
Pretty simple, actually.
Interesting. So it's like tricking the body into fixing itself.
Exactly. No external clotting factors needed. But let's talk about the exact mechanism of action. It's just better utilization of what's already there. Any thoughts?
All right, let's break this down. Desmopressin binds to V2 receptors, which are a subtype of vasopressin receptors. These are primarily found on endothelial cells in blood vessels and renal tubular cells in the kidney.
The V2 receptor's ligand binding pocket is located on the extracellular domain, formed by transmembrane helices and extracellular loops. This is where desmopressin docks and takes action.
You guys did your research.
And because V2 is a G protein coupled receptor, binding activates its intracellular signaling cascade.
Once desmopressin binds to the V2 receptors, it triggers the activation of the G proteins, which then activate adenylene cyclase.
Adenylene cyclin then converts ATP into cyclic AMP, which increases intracellular CAMP levels.
And the CAMP. It's the second messenger that activates protein kinase A.
Wow, you're actually explaining this correctly. Honestly, guys, I'm shocked and impressed.
Now, here's where things get interesting. PKA activation triggers the mobilization of Weibel-Palade bodies inside endothelial cells.
Those are storage granules containing the von Willebrand factor and P-selectin, which are important for clot formation.
Desmopressin simulates the release of von Willebrand factor from Weibel-Palade bodies into the bloodstream, increasing circulating von Willebrand factor levels.
So in layman's terms, desmopressin is shaking the storage container and dumping out the clotting factor that we need.
Yes, House. That's exactly what's happening.
Once the von Willebrand factor is in circulation, it binds to the platelets at injury sites, promoting platelet adhesion and aggregation.
But von Willebrand factor doesn't just help platelets. It also stabilizes factor 8, protecting it from degradation.
So indirectly, desmopressin also raises plasma levels for factor 8, enhancing the efficiency and the coagulation cascade.
Meaning better clot formation, less bleeding, and fewer ways for the patient to die. Excellent.
Even though desmopressin doesn't directly act on platelets, the increase in von Willebrand factor helps platelets bind to exposed collagen at injury sites.
That's critical for clot formation, especially in patients with type 1 von Willebrand disease who already have some sort of von Willebrand factor, but just not enough.
You almost sound like real doctors. Almost. Now go treat the patient before they bleed out.
Hi, pharmacy.
Hey there, so I have a patient suffering from type 1 von Willebrand disease, and I must administer desmopressin. I'm wondering, how should I go about this administration?
Okay, so you're going to want to do 0.3 micrograms per kilogram for adults and children with a maximum dosage of 20 micrograms. And that's for administration intravenously or subcutaneously. You can also do it as an intranasal spray, which would be 300 micrograms in adults and 150 micrograms in children.
Excellent, sounds great. Thank you so much. I will get back to you if anything comes up. Take care.
Thank you.
Hello. So we're going to be giving you desmopressin, which will boost your clotting factor.
Oh, what's desmopressin?
Basically, desmopressin works by compensating for a deficiency in your von Willebrand factor. So basically, it's going to bind to the cellular domain of the V2 receptor, specifically interacting with key amino acids, residues that stabilize the ligand receptor complex. These residues are located in the extracellular loops, transmembrane helicase, and the N-terminal domain, forming the ligand binding pocket. Once bound, desmopressin stimulates the release of stored von Willebrand factor, enhancing platelet adhesion and stopping excessive bleeding.
Are there any side effects?
Oh, absolutely.
So, how's your day?
Nothing interesting, just treated a patient for von Willebrand disease with desmopressin.
Pretty cool. House, come on, you know that can cause hypernatremia.
Yes, desmopressin is an antidiuretic, which means it reduces urine output and makes the body hold on to extra water, but we've been monitoring fluid intake. I'm not a resident.
Okay, I'll give you that. But you knew to tell the patient about the other side effects, right? Headaches, flushing, hypertension.
Yeah, of course.
Okay, just making sure, always have to cover my bases. Don't want Cuddy to kill us.
Yeah, we wouldn't want that, would we?
Pop quiz, people. What is von Willebrand disease?
It's a genetic bleeding disorder caused by defective or deficient von Willebrand factor.
All right, good enough. What is the mechanism of action?
It stimulates the von Willebrand factor, which helps with clot formation.
In baby terms, yeah, but it's no panacea, right?
It only works in type 1 cases, since type 2 and 3 have present qualitative defects. Yeah.
All right, look at you all, learning things. Now, everyone go. I have important medicine to do.
When life forces us to do something impossible,